It's just another Monday, and I got to tell you that with every Monday comes just another chance to reinvent yourself. And once in a while, we reinvent ourselves with Dr. Shaun Kondamuri of Midwest Interventional Spine Specialists. Doctor, how are you?
Doing great, Jim. How are you?
Doing all right. Let me turn your mic up a little bit there. All right. Give me another. How you doing, Jim?
Doing great, Jim. How are you doing, Jim?
All right. There you go. Much better. All right. Let me turn that up a little bit. There you go. Oh, it's nice and sunny out. I'll tell you that. You can see it right here along Indianapolis Boulevard. Whoop! I shut the
Beautiful day, Jim. Not as good as Saturday was, but it's pretty good here in the region.
Yeah,
can't complain compared to what we've been going through.
Yeah, there should be no complaints at all. Doctor, we are talking to Dr. Shaun Kondamuri, and he is with Midwest Interventional.
I lost you, Jim.
Set for about a half hour sitting here, and of course I just untangled myself. Give me a sec.
Kind of losing you there, Jim. Audio's not that good.
All right. Did you see that? That was rather acrobatic of how I could lose my microphone like that and bring it back. Doctor, tell us about where Midwest Interventional Spine Specialist is and what you guys do.
Yeah, we are Midwest Interventional Spine Specialists. We're in Munster, Indiana. We're in Dyer, we're in Hobart, and we're in Chesterton. And we are spine care specialists, so we treat primarily spinal pain, Jim, as you know. Probably 75% of what we do is treat pain that comes from your back or your neck. That results in headache sometimes, or sciatica, pain from spinal stenosis. We treat a lot of golfers who are just getting out onto the golf course now and they've hurt their backs. Backs are bothering them. We treat a lot of spinal arthritis, things like that. And most of the treatments we provide are non-operative treatments. We don't usually do typical surgeries. Almost everything that's out there that can cause you back pain can be treated with non-surgical options.
Over the time, thanks a lot for sponsoring here on WJOB, Doctor. And over time, we've used this time to talk a lot about COVID. It seems like it kind of took over everybody's psyche. Yes. And we'll get to that in a second. But one of the things people have to discern is, let's just say they are starting to have a headache of some sort, and those are, there's a lot of, whatever, I won't answer my own question, but, somebody has a headache, maybe it lasts for a couple days. How long before, what is the difference between, like, say, a COVID headache or like a pain headache that you guys deal with on a regular basis?
Well, so most headaches that people have are just plain old tension headaches due to stress, due to lack of sleep, due to muscle tension in the back of your neck. Those tension headaches can occur a lot more nowadays because people are in front of their computers all the time for meetings. People are doing Zoom meetings all the time, and that can definitely bring on these tension headaches. Patients usually know that that's something that they've been suffering from. There's not anything very severe about that they want to necessarily go to the doctor for on an emergency basis. But if the character of your headache changes, like if you suddenly start having issues like difficulty seeing, or the headaches have a different character to them, like they're felt in one part of the head, or if they are felt in a way that is due to some activity. For example, one of the biggest concerns is, what if you're weightlifting, for example, or you're doing something that causes a lot of physical stress and maybe raising your blood pressure significantly, then you have a sudden horrible headache. If you have a sudden onset horrible headache, you have to get to the emergency room right away, because that could be a subarachnoid hemorrhage. That could be a bleed that occurred because an aneurysm burst. And that is a medical emergency. You've got to get to the emergency room right away to be looked at. Patients will typically say, the quote that the patient will say that we're always taught as doctors is, patient will say, that is the worst headache I've ever felt in my life. And that headache is, and it comes on suddenly. So that's a scary thing. If you're talking about headaches just from COVID, it could take on any character, but it's just different than what you normally experience. If somebody normally doesn't have a headache, but for an occasional tension headache, and they now suddenly have headaches every single day going on for a week or two, then that could be related to COVID.
Hey guys, if you have any questions for Dr. Kondamuri, we can kind of go the full spectrum here. If there's anything you want to talk about, a lot of it has just over time turned into talking a lot about what's going on with COVID. And we once in a while we'll talk about spine and some of the pain there. So why don't we do that? A lot of people are getting out and they are starting to work in their yards. They're starting to do a lot more activities. I got to believe that this is the time of year where you start to see the person that's been sitting around all winter long got out and did a little too much. Anything you can tell these folks that do want to start getting active, how to, slowly get into it?
Well, you just hit the nail on the head. Just ease into things. For sure, you got to ease into it. And I mean, you've got to do some preliminary work, like just walking. You've been probably sitting around in the house a lot more than normal because it's so cold. It's been so cold outside. So now that the weather's warm, we need to get out there and start walking. Walk for 15 minutes, walk for 20 minutes, walk for 30 minutes if you can. That's one good thing. And when we say walk, you want to do sort of a brisk walk, not a very slow, casual walk, but a walk where you actually are using your arms and your legs a little bit more than normal, so it counts as exercise. If you do that, that gets your blood flowing through a lot of your muscles. You're activating a lot of joints and muscles in your body, and you're probably ready to do many things. But if you're going to start, for example, getting into your garden, this is a time when people are going to start maybe cleaning out their garden or start weeding their garden and things like that. You have to be really careful about bending forward or bending down to do that. You have a high risk of exacerbating some arthritis in your spine or exacerbating a disc problem that you might have. And those patients I end up seeing a lot, like right around now, the month of April or May is when we start seeing those problems. And that can be avoided by just easing into things and stretching a little bit and just going slow. Don't say, well, all of a sudden I'm going to go out there and work for 2 hours in my garden. Well, you're asking for trouble.
Doctor, a lot of people are out on the trails right now, and a lot of them are riding a bike, and you're certainly one of them, and so am I. I've been out quite a bit. I'm seeing more and more of these, I don't know what they call them, recline bikes or whatever. The guy has a flag up, and they're kind of laying flat, kind of like I'm doing right now, and they're pedaling so that their body isn't really bent. It's a lot less bent as they're doing that. How does that work with spine health?
So the recumbent bike is for somebody who really does have some significant spinal trouble, has pain in his back. He literally cannot flex forward at all. Patients who have spinal stenosis have a hard time bending forward beyond a certain point. They can bend forward a little bit. That actually feels good to bend forward like 10 degrees, but bending more than that starts hurting. So somebody like that might use a recumbent bike because you're always extended, you're leaning back. The vast majority of people just can ride a normal bike, but they shouldn't lean forward. They should just sit up somewhat upright, a little bit bent forward. And a normal bike is just fine. Road bikes, people who do road racing, like I know you do, Jim, on a nice road bike, there you tend to bend forward a lot more. So you got to be cautious about that because if you do have back problems, back pathology, that can set it off. So again, you want to just sit up a little bit more.
So in general, being less bent is better when you're using the big muscles of your legs then?
Yes.
Talking to Dr. Shaun Kondamuri. Doctor, let's go into a couple of COVID things. Right now, it looks and feels as if we're getting back to normal. I think the number in Illinois is 2,200 yesterday, and in Indiana it was only 730. And at times we were sitting here when Indiana's number was 4,500, 5,000 in a day, and now we're at 15-20% of those highs. Same thing in Illinois where they were up at 8,000, 9,000 at times. But at the same time, the CDC person came out today, and Director Rochelle Walensky said COVID counts give her a sense of impending doom and warned the public to continue following public health precautions with more contagious streams of the virus taking hold. It almost gets to the point sometimes where you almost can pick and choose what you want to look at. I mean, you can go out and see people right now standing there with no masks and not a lot of social distancing as if this was over. And then you can listen to the CDC director saying exactly the opposite. What do you make of that?
Well, so let's just restate some of the facts. So without a doubt, the numbers are declining since the winter peak, right? The numbers almost all over the country, the numbers have declined. But it's pretty unclear what's really going to happen going forward because certain super spreader events are probably happening. For example, right now, spring break is happening in different parts of the country. And like what in Miami, if I remember, it was like last week, they basically went into a state of emergency and they shut down all the beaches. They put a curfew up because there's so many people all over each other a lot of college-age kids or younger people who are enjoying spring break without masks, and they're all in very close proximity of each other. So that what can happen, it doesn't mean it will happen, but what can happen is you can have a super spreader event. So somebody who has COVID or caught COVID, they will spread it to a lot of other people. The same thing that could happen with spring break could happen when Easter happened. Easter's right around the corner. Memorial Day's around the corner. 4th of July weekend's around the corner. So the experts, the governmental officials, they have to side on the side of caution, right? So they have to tell us about what could happen and what the dangers are. And that's legitimate. And because their job is to look after our welfare and our safety, and just as yours is and mine is, right? Where people are listening to us and they hear what we say. So I don't want to be too casual about it. I mean, yes, numbers are declining, and yes, you can read it. You can look out on the internet and find anything to support your argument one way or the other. But some facts are there. Like, for example, even though Indiana's doing well, in Michigan last week, COVID cases jumped about 50% in just the last couple of weeks. You might say, well, why did that happen? There's several reasons for why that may have happened, but the fact is it's there. They're really on a state of alert now. They've shut down schools. Everybody's wearing a mask, or at least is being asked to wear a mask. While here in Indiana, just right across the border, on April 6th, we're going to be lifting the mask mandate. Now, I mean, I don't know about you, but like the border is not like some force field that germs can't cross. I mean, there's so much there's so many people transporting across the state borders, and things can certainly occur. What our healthier condition here in Indiana can be transmitted to Michigan, but Michigan's higher rates of COVID-19 can be transmitted to us. So, I mean, it's hard to say what's right. So I think we do still have to take some precautions. And hopefully, more and more people are going to get vaccinated. But that's a whole nother story. We can certainly talk about vaccinations and stuff, but there are still concerns. We're not entirely out of the woods, but clearly it's better than it was, 3 months ago.
Yeah, I think some of the numbers are over 1,000 deaths a day in America, and I think that's starting to make some folks a little aware. I mean, it really does. It's almost impossible to not see the dichotomy of behavior, and then some of the numbers actually creeping up. Now, you started to talk about vaccinations. More and more people are getting into that second vaccination, and it's more like a race to see if we can get everybody vaccinated before our behavior changes. I mean, what happens if our behavior totally changes before everybody, we have herd mentality or a majority of people vaccinated? What's going
to happen is this disease is going to spread again, and we're going to have more restrictions applied to us, and we're possibly going to see shutdowns again. Because if the numbers really, really escalate, nobody wants to be the way we were last summer and last spring, but that could happen again. You got to remember, even though vaccinations have been ramping up a lot, I think 130 million people have gotten a dose of vaccine in America, but only 50 million or so have been fully vaccinated. So that's just like 15% of the U.S. is actually fully vaccinated. I think it's actually less in Lake County, significantly more in Munster. Actually, this town of Munster has a lot more higher rate of vaccination. But bottom line is only 15% are fully vaccinated. And we know that a good 30% of Americans say that they are not or probably not going to take a vaccine. So if 30% of Americans says they're not going to take a vaccine, and you need about 70 to 80% of the country to be immune in order to get herd immunity, it's unclear. I don't want to kind of be a Debbie Downer, but it's unclear for sure what's going to happen because, you have vaccinations have to be done. Only 15% of the country is vaccinated right now. You probably have 30 million cases of COVID that have been reported in America. Probably another 30 million cases of COVID existed but just never got reported. Then you've got somewhere around 50 million people who've been fully vaccinated. That puts us at about 45% of the country has some immunity, whether from vaccination or from natural immunity from having the disease. So 45% is still a long way from 70 to 80%, which is what herd immunity is. So until you get herd immunity, this disease continues to move on. Maybe not as rapidly, but it continues to move from one person to the next. And if it does happen to kind of escalate in certain areas are going to have restrictions and they're going to have their lives change. They're going to go back on lockdown, and as much as we hate it, it's going to happen.
We're talking to Dr. Shaun Kondamuri here at the noon hour on AM 1230 WJOB and 104.7 FM. We're also streaming live on the Amazon, Apple, and Roku JED TV app and a whole bunch of other places. If you have a question, you can ask me or comments on any of this at 219-845-1100. It's kind of cool. You know, I'm here sitting at the, right here in the main control booth, and I've interviewed, I don't know, probably 20 doctors, maybe more, a couple dozen.
What's the general consensus, Jim?
Well, here's the thing. I get John Doherty, the guy from Community. I get Dr. Vavilala. I've had other sporadic ones that come on different shows, and pharmacists. But
you like me the most, right, Jim?
I very much enjoy talking to you. You make it pretty easy, to be honest with you. But I guess
what do they say? What do the others say?
I think what it is
she's speaking for the government.
Well, there's a lot. Dr. Vavilala and you could be interchangeable, to be honest with you. You guys are very similar, and same thing with Doherty. Beyond with John Doherty out of Community VP there. It was almost a year ago, right after COVID came around, he started citing all of these studies about possible long-termer problems in athletes. We're dealing specifically with athletes during that show, and he brought it up a lot early, and then he kind of said, well, I don't think it's real popular to talk about long-termers and about some of the damages to the different organs that they're finding with the research with people they've already found that had this, specifically amongst athletes. I mean, Jonathan Tays right now is supposedly all fatigued, and you get a number of athletes, but that is the one thing that has made me be very vigilant, was hearing him early on. I'm like, oh, whatever. As the president said, if I get the sniffles, I'm not that worried about it. I'm pretty in shape and, that kind of thing. But then it was almost as if you started to find two things. It was random on who it was really going to hit hard.
Yes.
And then the second thing is random on who it's going to hit hard for the long term. And that is the real fear. But that's the part I wanted to talk about, is long-term damage to organs. What are you seeing?
Well, so the term for that, usually when we refer to that population of patients, we call them long haulers. So the COVID long haulers, there's definitely a percentage of patients who are having symptoms even a year out. They got COVID back in March, let's say, and now they're still having, as you said, fatigue or headaches, or just kind of brain fog. Those symptoms are existing, and there are people who are incredibly functional beforehand, whose ability to function in the workplace has dropped down significantly because of these long hauler symptoms. The fact is it does exist. I don't think you can ignore that it's there. It's hard to discriminate who's considered a long hauler versus somebody who just, maybe is maybe not as motivated to get their body moving. It's hard to differentiate between them, but it does exist. People are there, and we're going to have to be dealing with this. The healthcare system is going to be dealing with these patients for a long time.
Heart specifically is the one that I think John and even Dr. Vavilala, and then I had a stroke guy on from St. Catherine's in East Chicago, and he's like, 4 times more, you're 4 times more apt to get a stroke if you've had COVID, and all these other statistics that keep coming out. It's enough to scare you. But specifically the heart of athletes, I mean, even if they're losing 5 or 10% of their possibilities of what they can, aerobically put through their bodies, they can't really compete at the very highest level anymore.
They cannot. You're absolutely right, because they are such they're fine-tuned athletes. They have to be at such a high, they have to perform at such a high level that if there's any decrease in their muscle strength, in their V.O2, which is the oxygen carrying capacity of their lungs, if any of that drops off, it's like they're out of shape. They're unable to perform, and it's going to take quite a while to rehab and get back to that. If at all, it does. It may not even happen.
We're talking to Dr. Shaun Kondamuri. Doctor, you said something earlier that was kind of interesting. You said that in Munster, what is it, like 15% now are fully vaccinated in America, but the number is higher in Munster. Around how much higher, and what would you attribute that to?
I believe it's approaching 40%.
Really?
Yeah, I mean, it's a lot higher. And one of the things is, you have a lot of healthcare professionals who live in Munster, doctors and nurses, so they're probably more aware of the value and importance of getting vaccinated. And also, sadly, if you compare certain communities, communities that are, more underprivileged, not as wealthy communities, for example, the simple fact of going out to get your vaccination done during working hours might be hard for somebody to do if he's working at an hourly job and he cannot leave work. That could be legitimately an issue. And also, just in a certain community, you might have people who just really are even more unlikely to believe in the value of vaccinations. You might have some concerns among certain people about whether or not this is real. Those concerns might be more in a poorer community than it would be in a wealthier community. So these discrepancies exist in America. It's not just in Indiana, not just in Lake County. It happens all over the country. And you see the same sort of trend where certain communities are suffering and not getting vaccinated as much.
Well, you brought up the disparity between communities. One of the, obviously the things that is also quite noticeable is the lower numbers in minority communities. Has that been improving in any? I mean, I haven't seen any market improvement compared to, say, the mostly white population. What do you see there? And once again, why do you see it happening?
I think it is improving, but is it equal? No, it's probably not equal. It still probably isn't. There's a lot of talk about that in the, last spring and summer, because poorer communities, people of color were maybe not getting vaccinated at the same rates as other communities. But I'm sure that that's improving a lot now, but it's still not where it should be.
219-845-1100. Let's take a couple phone calls. Hey, you're on with Dr. Shaun Kondamuri. Go ahead.
Oh, hi. This is Tom from Cedar Lake calling.
Hey, Tom.
I check into the demographic data of Munster. I think there's a lot of old people that live there because they talk about a lot that minorities haven't been vaccinated, but like with the Hispanic community, it's a much younger community, so they wouldn't be eligible yet. So you may want to check into that specifically with Munster.
So you're saying that if it's an older community, it would be a higher rate. Talk about your community. How do you feel? Are a lot of people getting it?
Well, I got my shot at the community hospital, and I'm 61, and it was all old people. So,
what's the attitude in Cedar Lake? I mean, we're right here. Doc was saying that roughly 30% are saying that they're not going to take it. You think that's about right?
I haven't run into those people, and I actually think I had it in December of 2019. So, and I took the shot. And I mean,
how long ago?
The shot, I'm due up for the second one in 3 weeks, about a week ago.
And how did the first one affect you?
Not at all. It was a Pfizer vaccine and could barely feel the needle. No, a slight arm pain, really almost nothing. I've been painting my daughter's house, and my arm hurts more from painting than from that.
All right,
I appreciate that you took it, Tom. That's a good thing you took the vaccination, because I wish everybody was taking it. I do know for a fact I don't know what I've not done my own survey of what percentage of people are choosing not to get vaccinated, but the national data is somewhere around 30% say that they definitely will not, or they probably will not.
That shocked me. I really don't run into people that say that. Maybe they're not, saying it openly, but I don't tend to run into people that say that.
Yeah. Hey, thanks a lot, Tom. Good to hear from you.
Okay, thank you very much.
Talking to Dr. Shaun Kondamuri of Midwest Interventional Spine Specialists, and obviously Doc's pretty well read and likes to talk a little bit about wellness. Doc, on the way out, we try to give one tip towards wellness: eating tip, mental health tip, general attitude tip. What do you want to tell people?
Well, I could tell you a lot of things, but I think one great thing that just sort of comes to mind right now, that I'm looking out my window, it's nice and sunny outside. I think you should just get outside. Get outside. The only thing I don't like about Northwest Indiana or the Chicagoland region is that we develop cabin fever in the winter, right? Because we never go outside. We're indoors for like 4 solid months. We don't even see the sunshine very much. Now the sun's out, take advantage of it. It's so beautiful to get outside and just walk outside, go into your backyard, even just sit in your backyard and look out there and listen to the birds chirp, listen to the tree, listen to the wind blowing through your trees. Anything like that is going to improve your happiness, your general well-being. We talked last time with Tony, Jim, when I spoke last time with Tony, we talked a little bit about just how so many Americans are less happy today than they were 10 years ago. Even though our per capita income, our financially, I think the country in general is better today than it was 10 years ago. Of course, barring what happened last year when COVID-19 put a lot of people out of work. But aside from that, in general, we're better off, but yet the country is less happy. So that plays such a big role in how you do in your personal relationships, how you do in your professional relationships, how you do at work and with your neighbors and everybody else. Do things to make yourself feel good.
A moment of hope.
And I mean, feel good naturally.
Yes, stay away from the artificial feel-gooders. Hey, Doc, it's always good to talk to you.
Thank you, Jim. Have a great day.
You too. And I will move off of that. And once again, this is sponsored by Midwest Interventional Spine Specialists, and they are in several locations. And Dr. Kondamuri has been around for a while, and he's becoming quite savvy at using